This video is brought to you by Straight Goods News, Canada's alternative online news source. Visit straightgoods.ca.
It has been 9 weeks since Minister Kenney announced severe cutbacks to healthcare benefits offered to Canadian refugees. From that day, there has been an unprecedented response from the medical community right across Canada. Pretty much every major medical organization has come out strongly against these cutbacks, including the Canadian Medical Association, the Royal College of Physicians and Surgeons, and the College of Family Physicians. On June 18th, a national day of protest was held in 14 cities across Canada, where more than 2,000 healthcare professionals came out to make their voices heard. Instead of a wake-up call for Minister Kenney, he has gone on the offensive, attempting to marginalize those of us who are speaking out against these cuts as activists and grandstanders, and failing to acknowledge that we speak for virtually all healthcare providers. This is not a fringe issue. It goes to the core of our values as Canadians. If we allow the government to indiscriminately decide who is denied health care, who could be next? From the minister's comments, it is crystal clear that these cutbacks have very little to do with health, cost savings, or public safety. While doctors have been largely focusing on the serious health implications of these cutbacks, Minister Kenney has been focusing on divisive politics, pitting tax-paying Canadians who are dissatisfied with their own health care against some of the most traumatized people in the world. He has consistently referred to refugees as bogus and has used a very narrow view of equity and fairness to support these cutbacks. This issue is about health, human rights, and dignity, and not about who gets dental coverage. There is no debate around the adverse impacts that these cuts will have on refugees. It will result in unnecessary pain and suffering, and people will die because of limited access to medical care. How can a government deny treatment for someone's hypertension, diabetes, heart failure, asthma, or epilepsy? There is also no debate that this will cost taxpayers money. Whether federal government plans to shift the cost to the provinces, it is still taxpayers' money. With Mr. Kenney's plan to stop coverage for primary care and push it over to hospital emergency departments, the cost of care will be increased several-fold. There is no debate that these cutbacks will compromise public health and safety. The fact that the government program will continue to cover the cost of HIV and tuberculosis drugs is simply a diversion. This is not the way we practice medicine. People, especially refugees, do not seek out health care until they are very sick. A system that is not able to provide ongoing primary care and prevention is a system that cannot protect public health and safety. So from a health care, a cost, and a public safety perspective, these cutbacks do not make sense. You will find no one anywhere that can justify these cuts as a way to save money or improve health and ensure public safety. If we had a minister who had any interest in refugees, he or she would be trying to strengthen health services in order to promote assimilation into our communities. Please tell me how, in a proud democracy, that one minister with no experience in healthcare, no consultation with health experts, and no plan to assess the consequences of these cutbacks can propose such a policy. This is not the Canada that I know, and this is not acceptable. As the clock ticks towards June 30th, we ask the government to rescind these regressive changes to refugee healthcare and to promote a system that is progressive, efficient, and equitable, and treats refugees with the respect and compassion that we all deserve.
My name is Parisa. I'm a former refugee, a family physician, an educator, and a mother of two. Refugees come to Canada not because we have a generous interim federal health plan. They come to Canada because the alternative is displacement, torture, rape, and death. Along the way, we lose our families, our friends, our home, our health, and our dignity. I stand before you today to thank you for what you did for me 20 years ago. I was given a second chance at life, a chance I've never taken for granted. It is thanks to your generosity that I survived and I became the person I am today. So I'm here to ask you to give the same opportunity to every refugee who comes to Canada and to not abandon our most vulnerable. I'm here to remind you that in this incredible country of ours, everyone deserves to be treated with dignity. Canada is built on immigration and refugees. How could we abandon our future Canadians? What will become of little children with horrific dental abscess? How can we afford alienating people we have invited to come to Canada? What chance do they stand if they can't learn English or French because they can't afford eyeglasses? IFH is not a charity, it is an investment. And I'm here to ask you to help us
My
save
name is
it.
Dr. Philip Berger. As you have heard, the consequences of the interim federal health program cuts will be devastating, and that is why more than a dozen national health professional associations have publicly declared their opposition to the cuts, and it is also why thousands of healthcare workers across Canada have hit the streets, spoken to media, written letters to newspapers, and contacted the members of Parliament. It is not too late for this government to reverse the cuts. The cuts were proclaimed by an April 25, 2012 order in Council and could be reversed as quickly as they were announced. Rescinding the order would be a good Canada Day welcome to terrified refugees. But doctors and other healthcare professionals have been disappointed by the government's failure to respond to any of our entreaties, nor have they answered the call of the many healthcare organizations to reverse the cuts. All this government can do is call our colleagues names and claim that we are wrong in our interpretation of the IFH changes. Worse, the government has never been forthright about the changes, and Minister Kenney even referred to the medication cuts as affecting, quote, unnecessary pharmaceuticals, end of quote. Now drugs for angina, diabetes, asthma, epilepsy, seizures, and other chronic conditions are considered unnecessary just because Jason Kenney says so. Minister Kenney has repeatedly spoken of equity, that refugees receive more than Canadians, and that the changes will put refugees at the same level of care as the rest of us. Under the current system, refugees, many arriving after years of neglected health, with no money, no family, and no support systems, receive basic dental and vision care, no greater than Canadians on social assistance or on welfare programs. Under the proposed changes, the refugees with dental abscesses will not get treated, and children trying to go to school who cannot see properly will not get their eyeglasses. This is Mr. Kennedy's idea of achieving equity. But more drastically, under the changes, some refugees will be denied almost all care. All refugees will be denied medications. Nothing that this government says about the IFH changes can be believed. Their statements have been false and untrue. But the doctors across Canada have not given up. We will be watching closely and confronting representatives of this government at the first instance of bad outcomes to any refugee arising out of the IFH changes. We have activated today a national system to collect stories, case histories of refugees who suffer illness, harm, and death because of the IFH changes. A detailed case reporting survey called Refugee Health Outcome Monitoring Evaluation System, or Refugee Homes, has been sent across Canada to all our physician members and colleagues. Our network of doctors across Canada will be reporting to us the details of any harm or death resulting from the changes. We will then report this and relay these stories back to the public, media, and most importantly to Conservative members of Parliament at public events, in their offices, and at any health-related political announcements made by this government. Not only that, our colleagues are contacting their respective provincial coroners to alert them to the changes and to be on the lookout for deaths that may have occurred directly as a result of the interim federal health program changes. We will push for coroners' investigations when warranted. We are stubborn, we're upset, and we are professionals. The government is hurting our patients. We will not stop ever, and we will not forget. The Conservative government, if they reverse the health cuts to refugees, could make Canada today, in 2012, a day of pride, a day to celebrate our historically best qualities of caring, fairness, and just giving people a chance.
So when you arrive in Canada in February, your main concern is really to figure out how you're going to survive tomorrow, because you don't speak the language, because it's pretty cold, and you don't have the proper boots to walk around to make it to your French class or your English class. And I was lucky enough that at the time I had the coverage, so when my teeth started hurting, I was able to access a dentist. Now that dentist didn't just take care of my teeth. It turned out that because I only spoke Persian at the time, he was a Persian doctor that somebody had recommended to me. So on that cold day, when I went to see him, completely indignified and desperate to survive, walking out of his office, I thought to myself, I can do this. This country allows me to become someone who can give back. So it didn't only look after my teeth, the interim federal health. It helped me orient to this society. It actually gave me hope, a hope that I had lost along the way. And it allowed me to carry on and to learn French and to learn English and to move on with my life. Had I not received that care, I would be going from one emergency department to another. And I don't even know how I would have come up with the money to pay for it, because I didn't even have a whole lot of money to pay for my food. So I really don't know what it would have become of me if I hadn't received that care.
Allow me to play devil's advocate here, but you mentioned dental care and eye care. These are two categories of cares that are not covered in many provinces by any Medicare. I've been paying for my glasses for 25 years. I have to pay for my dentist out of my own pocket. So I guess some Canadians are asking, why should we pay for them when we have to pay for our own care?
It's actually mostly Minister Kenney that is asking the question. Yeah, I know you're asking the question. I'm going to answer it. The refugees that come here poor, actually poorer than many people who are on social assistance and receiving welfare benefits. They're really equivalent in status. Their health actually is often much worse because it has been neglected for many years, and many of them have been through trauma, physical violence. So really the benefits, and they're very basic vision dental benefits that the refugees are currently receiving, are the same as hundreds of thousands of Canadians who are on government assistance of some sort. The only difference is the refugees that come here have way less connections and no means at all to purchase glasses or get basic dental care.
How long are refugee claimants on the interim federal plan? Usually?
Well, we don't, it's changing. According to Minister Kenney, it's going to be a lot shorter because the refugee application process is going to be a lot shorter. But some refugees have been on it for years during their hearing delays and during the appeal period.
But if the minister manages to shorten that period, they may have access to some of these if they go on social assistance or something.
There's often a delay between getting on social assistance, and the plans vary across the country. For someone on insulin, they can't do without the drug for a single day, actually, and the same with anybody with seizure medications. If you read the government documents, they're quite extraordinary. Under the section called angina, government says we're not paying any medications for the basic medications required to keep people stable and healthy and preventing a heart attack if they have angina. They're on their own. Someone with angina cannot do without their medications for a day. They'll be at risk of a major cardiac event and death.
Another question is, to be fair, it looks like the government has absolutely no interest in backing down whatsoever. So besides this sort of national survey where you're planning on keeping track of some of the possible impacts of this, what else? Will we see continued interruptions of ministers' speeches and things like that? Is there anything else?
There are groups spontaneously forming across the country and individuals who are appearing at press conferences and announcements by different Conservative members of Parliament and cabinet ministers who are doing their own interventions. Our plan is to go forward once we collect these cases and engage Conservative members of Parliament at public announcements, at public events, and in their offices in whatever means we can. The government has not offered us a platform to engage with them. They refuse to discuss any of these changes. The government has not consulted any of the national health associations, nor have they responded to the open letter that all these national medical associations disclosed to the public. They're freezing everybody out. It seems that Minister Kenney has put himself in the position of making medical decisions on behalf
of doctors who ignore the changes and continue to provide service.
We are not aware of any physicians who will refuse to provide pro bono service. We just won't get paid, which is not a big issue for any of us. In fact, it's not the issue at all. The real problem is going to be the inability to get certain diagnostic tests done, like laboratory testing, chest x-rays, and of course to prescribe necessary medications to patients. And to be quite frank, we don't know what to do. And there is real panic among many healthcare providers at St. Michael's Hospital where I work. They're all saying, what are we going to do June 30th? We don't have an answer for them. The system the government has set up through Blue Cross is an impenetrable bureaucratic system requiring physicians and other healthcare providers to go on websites, make phone calls, get pre-authorization. That's not how medicine is practiced. Medicine is not practiced according to an 8-page booklet put out by Blue Cross.
We saw the Natural Resources Minister Joe Oliver's speech at the end of last week disrupted by a doctor at a med student in Toronto. Are they affiliated with you? Is there an ad hoc network of doctors who are going to be disrupting these press conferences?
Of course, there is an ad hoc network. I mean, some of them, what happened in Surrey, British Columbia yesterday with Minister Kenney, we didn't even know about till we read it in the newspaper. So there are clearly spontaneous actions being conducted by healthcare workers who've been shut out completely by Minister Kenney and the government. And we're not orchestrating them. We're not objecting to them happening. We fully understand the agitation, the anger, and exasperation of the healthcare providers.
I'm confused. Didn't you say, I just want to clarify something, that you would continue to possibly, go to public events where ministers are speaking?
The group Canada Doctors of Refugee Care, once we get our data that will be produced through the survey that was designed by academic researchers in Toronto, once we get that information, then we will engage Conservative members of Parliament wherever we can find them, at public events, at press announcements, in their offices.
If nobody else has a question,
Sure.
It's a pretty basic question, but could you go through, please, what kind of services are now covered that will no longer be covered? I'm a bit confused as to...
No, I mean,
I'm a
well,
bit
they're
new
quite
to this topic.
I'll let Dr. Tyndall, if you want to go at it. We have a document here if you want to.
Sure, I can take a stab at it. I mean, it's quite complicated for us also. So there's different categories of refugees. The people that are brought here by the Canadian government will be now denied the pharmaceutical benefits, the vision benefits, and the dental benefits. People that are considered from countries that shouldn't be producing refugees, which countries have not actually been published yet, will be denied all services outside of emergent care. So the only option for those people that are considered not eligible for refugee status will get no health care. People who are failed refugees will get absolutely no health care. So those are wiped out. And it sounds, I think, to the Canadian public, well, that's reasonable. If they're a failed refugee, then why should they be getting benefits from the government? But the fact is, they're still here. If Canadians want to stumble over them on the street when they're dying, I mean, that's one option. But I don't think that as physicians, we're not the refugee police. So there's a whole mechanism in the government to find people that are not eligible to be in the country, and we're not that's out of our hands. If people have the proper documentation when they come, we know what they qualify for. But there often people show up without those documentations. They have a acute illness. Some are potentially a risk to public health and safety. I think we have to do something. So if somebody comes in without any documentation and we suspect they have tuberculosis, I think we have some obligation, whether they qualify or not, that we should provide them some care and treatment.
You mentioned that you had to go through paperwork, so I'm just trying to
Yeah,
find
no,
out,
there's
are
a
you
whole
expect to call the government
Yes.
to know the status
Well,
of that
call
person?
Blue Cross, which is the agent of the government. I mean, you really have to read this fantastic document. It's just unprecedented. I've never read anything like it in 42 years since I graduated from medical school, where the federal government, Minister Kenney, puts out a document of giving examples of coverage for selected conditions. For refugees who have failed their claim and may be appealing it, or from so-called safe countries, there's a section here called medical emergency. Coverage, none. Look at this, none for a heart attack or a stroke. This is Canada?
I think I just want to make a correction here. We're not concerned about being paid for our services. So I guess our concern is that a woman coming in to the emergency department with her asthmatic child, and we spend time in the emergency department, very expensive use of system, stabilize the child, admit them to the hospital 3-5 days, expensive provincial health money. Then when I'm discharging this woman, I'm going to have to say to her, good luck. I'll see you next time in emergency department, because she can't afford that asthma medication. Okay? That's where the problem is that not paying for these medications are going to have these patients coming from the emergency department, going home and coming back. So this is an offloading of our healthcare money from the federal budget to provincial health plans. And we're going to all pay for that.
Mental health, where does it fit in those categories?
Well, I mean, you got to read the document because, again, the Minister Kenney and the Conservative government will provide coverage and treatment for refugees with psychotic disorders, but only if they're a threat to public safety. If the refugee is suicidal, no treatment. But if they're a threat to you and me, yes, there will be full coverage.
3 categories?
For all 3 categories. But if they're about to kill themselves, they're on their own.
And just to speak to that, postpartum depression, women with postpartum depression, they don't just kill themselves. They also take the life of their children. So technically, they're not covered for their medication. But what will happen to that woman and her children should she not get treated?
In the case of someone who's suicidal, a woman with postpartum depression, from what I understand, the majority of refugees would go to the doctor, would get diagnosed, would get sort of basic treatment, but might not would have to pay themselves for any medication for those. But if someone was suicidal, wouldn't you still go?
Our interpretation, no, they for sure would show up in an emergency department, and no hospital emergency room physician would ever refuse to treat them, so it would hopefully get them over the acute crisis. Of course, if they're admitted to the hospital, along with the emergency visit, that cost is going to be the hospitals to bear and the provincial healthcare systems to bear, because in Canada, we don't send people out with, even though they don't have health coverage.
I meant like if for whatever reason, if I went to the hospital and I was suicidal, there would be treatment for that, and it would be the same case for.
No, correct. Only because the hospitals in Canada don't refuse treatment because of the inability of people to pay or their failure to have health insurance. But once they're discharged, they're on their own again. I mean, the other concern we have, of course, that many of these refugees may not show up till the last minute with whatever condition they have, and it'll be too late in their illness, whatever condition they have, to remedy it properly. But, Minister Kenney wanting doctors and hospitals to treat people in emergency departments is not the way medicine is practiced in Canada, and that is going to be the de facto result for those that happen to make it there alive.